One of the most common things that we take care of as orthopedic foot and ankle specialists are traumatic injuries. Patients can have low energy trauma, such as just falling from a height or falling while playing a soccer game, to high energy injuries like falling off of a roof or being in a high energy car accident. This can lead to a lot of broken bones in the foot and ankle. Not all bones that are broken need an operation. We've only had these surgical tools for 100 years or so. Prior to that, everything got treated with a cast. The times that we intervene with plates and screws are when the bones are broken in a way that they just won't heal unless put back together, or if they're going to heal in a manner that will make them unstable for that joint of the body. Most of the time when we're looking at the foot, fractures in the front part of the foot, of our toes, generally don't need to be treated with any surgery. Most of the time, as long as the toe is lined up straight, it usually heals in about 6 weeks. We frequently will put patients into a hard-soled shoe on the bottom of their foot and allow them to walk on it right away. Just because we say they're allowed to walk on it doesn't mean we're able to walk on it, and so sometimes patients need crutches for fractures of the front part of the foot. The middle part of the foot is actually a very important part of the foot for stability. The middle part of our foot has no motion. There are lots and lots of little joints in the foot in the middle part, but none of these joints really have a lot of motion. The purpose of the middle part of the foot is really to be a rigid lever between the ankle and the front part of the foot. Fractures of these bones very frequently need an operation. We do tests like x-rays when we're standing on it to look for signs of instability, but because we need this area to be rigid, if we break or tear the ligaments in the middle part of the foot, most often it's going to need an operation. As we move back into the ankle is probably where we see a lot of injuries. When we injure our ankle, it can be something like a sprain. A sprain is nothing more than tearing of a ligament. And in most situations, tearing of those ligaments does not need surgery on the front end. Patients can go into physical therapy, they can wear a brace, and if they have problems with instability in the future, then we can intervene with reconstructions of those ligaments. When we break the bones, though, that is something that really needs to be evaluated by an orthopedic surgeon early, because bones in the ankle are very important for the stability of the ankle. The times that we operate on ankle fractures are when it's unstable. The ankle has 3 main parts of stability: the inside, the outside, and the back. In general, if we just break one of those 3 areas, it often does not need an operation. The bones will heal in about 6 to 8 weeks, and then we can start walking on it again. There are situations where even just breaking the bone on the outside of the ankle, if we also tear the ligament on the inside of the ankle, then that needs to be fixed. If you break 2 or more of those areas of the ankle, the inside, the outside, or the back, it almost always is going to require surgery to fix that. The purpose of surgery on the ankle fractures is purely about getting the bones to heal in the proper position. It's about putting in hardware to put the bones into the correct position so that they heal in a manner that's stable. Surgery does not speed up biology. It is important that after surgery of the ankle, patients are not walking on it for a full 6 to 8 weeks to allow the body to heal. The hardware will not just heal the bone itself. The body really has to do that. When we fall and twist our ankle, we really need to listen to our body. If you're able to get up and walk on the ankle and limp, but you're still able to do the things you want to do, it's fine to go home and put some ice on it and see how this evolves. For most simple sprains, the pain is going to calm down overnight such that you can continue to walk on it. But if you have pain that really prevents you from putting any weight at all right after the fall, that's something that we need to know about right away. And we have walk-in clinic at all of our locations. We have after-hours clinics. You can always get in to see us very quickly at Campbell Clinic to determine whether you have something that needs to be addressed urgently, or if it's something that we can assure you that it will resolve over time without any operations. For fractures of our feet or our ankle, most of the time those surgeries need to be done within the first week or 2 after the injury. And so letting us take a peek at it early is always better than seeing it too late. The bones in our feet aren't necessarily more prone to fractures, but we have a lot more bones in our foot. So there are 28 bones in the foot, and any of those can sustain fractures or sprains, and so there's a higher chance that you can have injuries of the foot. Because we walk all of the time, it's very important to get that stability back to the foot early. And oftentimes with fractures that are unstable, that means surgery and then about 6 to 8 weeks of not walking on it to allow the body to heal.